One of the fundamentals of OAFI, and probably one that's less known by the audience, by the public, are clinical trials. And this is why I often ask for people to become members. Just by a very low fee, you can become a member at OAFI, and so that we have the muscle and do things for the benefit of OA patients. And the type of trials I'm introducing now is one example of this. This is the Triankle trial. Ankle, you know what that is, and then try for the 3D printing. This is what they're doing, 3D collagen printing for patients with a tendinopathy. So this is being done now, and I'm sure that the future will even bring more success stories. And we will have Nina Martínez, head at R&D at OAFI. Round of applause for her. Please come to the stage, Nina. She will deliver a presentation along with Dr. Jill Rodas from FCB's medical staff and the sports medicine unit at Hospital Clinic and St. Joan de Déu Hospital. Welcome, Mr. Rodas. Thank you, Nina. Thank you, Dr. Jill. You have the floor. So, good afternoon, everyone, and welcome. As Ricardo rightly mentioned, ours is a kind of a special foundation in that not all foundations have an R&D department, and we participate in clinical trials, and one of them is this one, the Triankle trial. As you know, both tendinopathies and OA are very frequent conditions. Close to between 30 to 50% of the injuries in sports are tendinopathies, and there are an estimated 500 million people in the world that have OA, with some high costs in treatment. What are the available tools to approach these injuries in the joint tissue? As we have heard, we have a conservative approach, conservative treatment, and then you have surgery. But so far, none of these has made it possible to have full healing. And the risk of a new rupture is particularly high, even more so when having a conservative approach. And considering this lack of treatment, this is why we came up with this idea, Triankle, with 12 organizations, and you can see the 12 represented logos here from 5 different European countries, with a project that will last for 48 months and financed by the EU Horizon 2020 program. This is targeting patients with a partial fracture for the Achilles tendon, and then with this bone joint defect in the ankle's articulation. We want to improve the portfolio of treatments for all sorts of patients. That would be athletes, but also people at an advanced stage in their age. Also to better understand the social, ethical and regulatory aspects in therapy, and we want to improve the applicability and efficiency of the treatment by the proper use of collagens and regenerative substances. Collagen. We have heard about it in several of the presentations. This is a natural protein that can be found, as you see, in several areas in our body. And what we want is to use it in the most possible native way to keep the mechanical properties provided, and therefore to imitate the features both of tendons and cartilages. And what about this regeneration? How is that attained? Mostly through stem cells, but also through growth factors and the combination of both. What's the method? As you can see, by means of these scaffolds, we add these active ingredients providing for this regeneration, and by means of 3D bioprinting technology, we print the implant, both for the tendon and the cartilage, so that is used for patients in need of them. Bioprinting, I know that it sounds like very much sci-fi, but it's done with this type of devices, and Selink is one of our partners in this project, so that we can have this type of implants. The road, the pathway to the patient. Once we have these printed, we need to see how they behave in an in vitro setting, and then we test it with animal models. First with rats, and then with sheep, so that later, once we have the appropriate results and we know that this works indeed, we can use it for a human model. Again, the project has a duration of 48 months, and so we need to go through all these steps. So what's OAFI doing here? Because you might wonder, well, this is a highly scientific project and you're a foundation, no labs. Well, we play an important role, and that is putting the patient at the core. So we want to assess the patient's needs, and we want to know what will the patient think about this therapy. So once we have all this information, we can convey this back to the partners, and so that this therapy is really fitting to the patient's needs by being accountable but also participating in their treatments. And on the one hand, we've done a literature review, and we've also organized focus groups. The literature review, what we have done in order to prepare later for the focus groups, we have reviewed literature on the quality of life for patients with tendinopathies in order to know all the needs as previously described in research. We review several databases in papers, and then we select the ones that would fit us most and that would prove and indicate the quality of life for these patients. The results obtained after this literature review, and as it has been said before here in this Congress, is that patients with comorbidities have a worsened quality of life. And also we have seen in several papers that women do not feel as benefited by treatment, here mostly on rehabilitation, and usually have a worse quality of life than men. Also, most patients feel like frustrated because, on the one hand, either the practitioners have not properly explained to them their disease, and also that there are several views and opinions, so that they don't understand their condition properly. Patients also consider that there are some aspects in the hands of professionals, such as education, a more customized approach, also a better understanding of the social setting and their lifestyle, and a better follow-up. And this has also been expressed here at the Congress, where we are seeing how this follow-up is kind of lacking. Then, surgical intervention and the impact it has on the quality of life is dependent on several factors. In an urban center, that the experience is quite different from a rural countryside, and you can find a betterment in the physical components, but then usually on the mental side there were much differences appreciated. On focus groups, Basically, we want to bring together groups of patients and to ask them a set of questions so that we can see their experience and their view on this therapy to better understand their expectations and needs. We want to know what they know about regenerative therapies, because nowadays bioprinting with active ingredients and stem cells and so on may scare some people away, or people just don't understand it and may think that might not work for them, and they would rather choose the therapy that they've been on for long. And we want to hear proposals for them in order to improve the acceptability of this type of therapy. What are the steps? This is why we have first gone through this literature review, because we want to know what's in the literature, what's in the papers, and so that we can first design the trial. Then we determine the patient's characteristics, because we have inclusion and exclusion criteria that bear in mind the type of patient that we want to ask. Then all the proper paperwork, for instance, informed consent. Then we produce a questionnaire with all the questions we want to ask them. And then we have the focus group day, as we call it, in order to finally deliver a report that would later be disseminated amongst our partners. So this is, in a nutshell, and just very quickly, what this Triankle trial is about. And now I'll have Jill with me. Now, your explanation went so well that, well, just a couple of take-home messages, if I may. First, Europe is making a significant investment on funding projects on things related to osteoarthritis. And this is important. It's several million euros devoted to the betterment of this condition. And then secondly, we need to have a multifaceted approach at this condition. You can see how many athletes and top athletes, as is my background, can also improve on that. For instance, there is an overlapping in the cartilage injuries and the tendon injuries. You know that in professional sports, these type of injuries are much an issue. Now, cell therapy, stem cell therapy, is being researched, and probably this is one of the therapies that will provide us with better outcomes in the future. And I'm sure that we will benefit from this. But we need some sound and rigorous trials in order to prove that they are useful indeed. And this is how you begin. This is a trial. We started off with some pieces of cartilage of Nina or myself. No, we didn't. We started with animal models for rat and sheep. We cut a piece of their cartilages and tendons, and then we use a well-designed product with mesenchymal cells that, and there are two types, the ones that we get from the marrow and the ones we get from the fat. So we implement them through scaffolding with growth factors, and then from here on we need to see if by using this strategy we improve on the injury. I do think that cell therapy will play bigger role in the future, but like any treatment, there needs to be some scientific grounding to prove it works. And bear in mind, cell therapy is not lab dependent, but it's us dependent, because it's our cells. And so far, I'm sure that there might be some questions. So how about we sit down for questions? I have a couple of questions myself. One for each. This trial has been going on for some months or years. I know about that because we've discussed about this in our radio show, and I get to know what you are doing at the R&D department at OAFI. So I was wondering, what point in time are we in this project? Are we about to see the end? Now this lasts for 4 years, and we are now at a time where we have the injury model. And this very morning, 8 a.m., we were cutting slices, and we are waiting for the product. Again, these are 14 companies trying to get the best product so that we can later implement it and see the outcome. We are in between the reception of this product and coming from different areas in Europe with parts of the collagen and the factors, and these will be used in the animal model that we have prepared. So this is where we are now. So you know that raw materials find it hard, shipments, there are borders blocked. Could this delay the project? Yes, it can. Hopefully it won't, but I guess that 14 organizations, considering their significance, is no mean feat. Yes, we were discussing this with Amaya, and she has a good deal of expertise on European projects, and she was saying that you work well as a group, you are right on timing, and these often, well, there are some issues often around that, but here, no, we know that what's at the core is the patient and how to give a better life to the patient. And the industry, the labs, are working for us, for patients, and doctors themselves can be patients every now and then. Nina. We are looking for volunteers. We are for the clinical trials. You know that we need people on stage 3. So this could be later disseminated to the public. How could a person join if he's interested in this trial? Well, first, to get in touch with us at OAFI and tell you're interested. Write us an email or phone us, and as I was saying, there are some inclusion and exclusion criteria. We would see if the patient meets the criteria, and if so, if there are no issues, then we would count on that patient for the focus group. And so I would invite you to join us, and the more the better, and the sounder the final report that we can provide to the different organizations. So we're waiting for you. Maria Teresa is willing to receive your phone calls at our telephone number. Have you ever seen such a smiling speaker as Nina? This niceness, this joy, this sympathy. Well, they've been so efficient, as a matter of fact, that they have given us some 10 minutes for questions, in case there are any doubts or comments for either Nina or Dr. Rodas. And please wait for the mic. Okay, Dr. Baquero. Thank you very much. It's always a pleasure having you here. One thing I did not quite get was 48 months. And in these 48 months, that's not just for the trial part, but also the human part, the human model? No, we were talking about the up until the animal model only. But then there is a part where we ask patients what do they think about this therapy. But we stay at the animal model. It will probably take some 2 or 4 extra years in order to later be implemented into the human model. It's true that people are telling that much is being done on cell therapy, but usually it takes some extra 2 to 4 years to later be used for humans. But anyway, this is how far we're getting it, and hopefully later we will move things forward for humans. But unless there is a commitment and a need by patients, how should we? So this EU initiative on trying to incorporate the patient so that they can bring their feedback, I think that's great. And some 10, 15 years ago, this wasn't happening. This is something new. Yeah, the patient at the core. I remember it was our first Congress at OAFI. There was a discussion on the need to have patients from the very scratch incorporated, even for clinical trials. Any further questions? Yes, Nina. What can I tell you? You're my right hand on R&D, so congratulations. And Dr. Gil Rodas, I've had the pleasure of getting to know him for years. He's a smart, brilliant doctor, with a sports expert, and much like we've had this morning's a sports expert as well. So, as I've told you often, today we have seen the product presented here, and for the first time patients have seen the results before doctors. I think that's something to be remembered. But this is why R&D it's important, because we have repeated that we are lacking treatments for OA. So anything that works on the R&D part is really important. You have seen the outcome through the GODI trial, and what I mean by this is that we can all help on improving the treatment of the condition. It's on us. Ideas, the networking, the companies. We are open to do what it takes. Sometimes the craziest ideas end up being the best ideas. So anything that comes to your mind, any person you might know, please come and tell us. Sometimes we get the information and there is this product, and well, we look at it and we realize it's just fake news. Well, we'd rather have that and know that there is a fake news rather than missing some good news that we don't make good use of. So, just my comment on that. But okay, that was not a conclusion. Yeah, let me add a thing here. I would like to make a call, not for all the attendees, but people that might be following our streaming in YouTube, in that we are open to join any trials. As Hill was saying, this is moving forward and they can count on our association, and so that patients feel like really are part of these trials, which often are not. Now, isn't she wonderful? It's always a pleasure when seeing these names popping up, like Dr. Gil Rodas. He often comes, and Dr. Vergés and OAFI. We would like to recognize the fact of him coming today. Please stand up. Thank you. My trousers are dropping down. Sorry. Dr. Gil has always been supportive with us. We have a group of doctors that has always sided with us. And when we had a discussion on contraprotection, we brought up your name, even though you weren't there, because he was a pioneer on that. So this is just a small gift to consider all the affection we have for you, and please keep it up. Keep up the passion, because we often have to confront many challenges. So thank you for that.